Now, infertility is a difficult and very emotional journey, and ARMS, Arizona Reproductive Medicine Specialists, understand how overwhelming it is, and they are there to help. Joining me now is Dr. Drew Moffitt, along with his patients, Shannon and Justin, and, of course, their little baby girl, Lilly, who's about 4 months old. Welcome, everybody. Good to see everyone, and so happy you have Lilly. I want to start with you two first, if you don't mind, Dr. Moffitt.
Sure.
Tell us about how long, what you went through before you finally came to ARMS.
Well, basically, I was 15 years old and I was diagnosed with PCOS, and I was told that my chances of having a child would be slim to none. And I knew that growing up, I guess, you know, from a teenager on. And so it was something that I always kind of knew that I would have to do, is go through infertility treatments, but...
And she wants daddy. She can go to daddy. Dr. Moffitt, for people who are watching, what is PCOS? They may wonder, well, what is that?
Well, PCOS stands for polycystic ovary syndrome, and it's a problem where you don't ovulate, and it's extremely common. And but if you start early, it's fairly easy to take care of.
So you were able, obviously, to help these two and this beautiful little girl here. Tell us about a little bit about how you were able to help them.
Well, we always start with doing some simple tests to make sure it's not something else, because we feel pretty silly if we think it's just an ovulation problem and then a year down the line it's something else. But when everything turns out simple, then we give them a simple medicine, usually called clomiphene citrate or Clomid, and with some proper monitoring, they can ovulate. About 75% of people will get pregnant within 6 months.
I see. So what brought you guys to Dr. Moffitt? Because you kind of knew your chances were going to be slim. You meet each other and you want to have children. So, of course she gets fussy during the segment. So what brought you to Dr. Moffitt?
Basically, we did our research. We tried on our own for a couple of years after we got married, and it just didn't happen.
I see.
And so we did our research, and ARMS is what we found was best, you know, from reviews and everything, just like anybody would do online and, you know, other people. So we went to them, and as soon as we went to our first appointment, we just felt comfortable, and we just took it from there.
Wow, so you went through the treatment that you just mentioned, so not too severe, easy to get done, and here you are with a beautiful little girl and a great experience, obviously.
Oh yes, it was. He did the right process, and it made everything fast and easy for us, and we were really comfortable. Like all of the testing that needed to be done was done properly, so we were pregnant on our first cycle.
Is that common, Dr. Moffitt, for people to have such success like this?
Well, if it's just an ovulation problem, the treatment gets them back to what normal fertility is, and normal fertility is about a 20 to 25% chance of getting pregnant each month. So kind of the message is that a lot of people think that if they're going to go to an infertility doctor, it's going to be really hard and really expensive. But most of the time, it's a simple problem. When it gets more complicated is when people delay, come in much older in their lives, and then it's more complicated.
Or they try all these other things, and it gets to be just this uphill battle, and some people give up, but there's so much you can do to come see you. If people are watching right now, maybe went through something similar, what advice would you give them? I mean, I'm looking at you, you're like, I mean, here you are, dad of this beautiful little girl. I mean, it's life-changing, obviously.
My advice would be just, you know, just do it. Yet really don't wait until you're older. You know, just go in and do it. You have nothing to lose.
Yeah, you have a biological clock, especially as a woman, you know, with your eggs, and, you know, the older you get, the less chances you have. So a lot of times people think that it can happen on their own, and we were told that it would happen on our own if we just waited for it, but I didn't want to be, you know, that person that waited forever and it was too late.
Oh, well, we're so happy for you guys. She's fussy. She's been great this whole time until the TV camera, right? Hi, Lily. Hi, baby. Dr. Moffitt, before we leave, we want to talk about the bioclock. You talk about that a little bit. Oh, you can give her a toy. Give her a toy.
Well, Shannon brought it up. The biggest problem we face really is people coming in later and when their biological clock's a little further on. And so what we've tried to do is encourage people to come in early and just have that checked out. And so we now have a test that allows us to give them a pretty good idea where they stand on their biological clock, so they can know, well, you know, I've got plenty of time, or no, wow, we really need to get going.
Yeah.
So it's pretty simple, and it's only $99, and it's just a blood test.
That's a great idea, too, because maybe you want to, but you're not ready yet, but you want to know how much time you have. It can help make the difference. Thank you so much for joining us. Thanks to both of you, and congratulations on your beautiful, beautiful little girl. It's okay, Lily. We can be loud. It's all right. So if you would like more information about ARMS, Arizona Reproductive Medicine Specialists, just visit them online at arizonafertility.com, or you can call the number you see right there on your screen.